Hello, I am Gando from BSN-1A, and I will be reporting about adding medications to intravenous container, administering intravenous medications using IV push, and administering ophthalmic instillation and irrigation. First one is adding medications to intravenous fluid container. Adding medications to intravenous fluid container is intended to provide and maintain a constant level of a medication in the blood, and to administer well-diluted medications at a continuous and slow rate. It is the safest and easiest way to administer a drug intravenously because the medication is first diluted in an intravenous fluid before it is administered to the client. The assessment. Prior to adding medication to intravenous containers, inspect and palpate the intravenous insertion site for signs of infection, infiltration, or a dislocated catheter. And inspect the surrounding skin for redness, pallor, or swelling. And palpate the surrounding tissues for coldness and the presence of edema, which could indicate leakage of the IV fluid into the tissues. Take vital signs for baseline data for medication that is particularly potent, and determine if the client has allergies to the medications, and check the compatibility of the medications and the IV fluid. Kailangan i-check po yung compatibility ng medications and IV fluid because yung ibang medications is hindi compatible sa IV fluid and minsan nag-cause ng precipitation kapag hinahalo sa IV fluid, which is makaharm sa client kapag na-administer siya na ganun. The equipment. The client's MAR or medication administration record or computer printout to check the medication ordered. And correct sterile medication. The diluent for medication in powdered form. Correct solution container, if a new one is to be attached. Antiseptic swabs. Sterile syringe of appropriate size, 5 or 10 ml. 1 to 1.5 inch number 20 or number 21 gauge sterile safety needle, if not using a needleless system, and intravenous additive label. The implementation, the preparations, performance, and evaluation. First one is the preparation. Check the MAR or medication administration record. Check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. I-check po yung label in comparison with MAR para ma-check na tama yung medication na ilalagay sa IV container. Read the label on the medication when it is taken from the medication cart and before withdrawing the medication and after withdrawing the medication para ma-sure po talaga na yung medication na i-administer or ilalagay dun sa intravenous fluid container is yung ordered by the physician. Confirm that dosage and route is correct. Verify which infusion solution is to be used with the medication, which is usually ginagamit is normal saline, sterile normal saline or 0.9 sodium chloride. Consult a pharmacist if required to confirm compatibility of the drugs and solutions being mixed, and organize the equipment. In the performance phase, perform hand hygiene and observe other appropriate infection prevention procedures. Number 2 is to prepare the medication ampule or vial for drug withdrawal. Check the agency's practice for using a filter needle to withdraw pre-mixed liquid medications from multi-dose vials or ampules. Then, add the medication. Adding medication to new intravenous container. First is to locate the injection port. Clean the port with the antiseptic or alcohol swab to prevent the introducing of microorganisms in the vascular system of the client and to ensure the sterility of the procedure. Then remove the needle cap from the syringe. Insert the needle through the center of the port and inject the medication into the bag. Activate the needle safety device. I-sure po na natama yung pagkahawak dun sa injection port para at tama yung pagkalagay ng syringe para di ma-puncture or mabutas yung intravenous fluid container kasi kapag nabutas yun, magli-leak na yung fluid sa loob. Then, mix the medication and solution by gently rotating the bag or bottle to mix it evenly. Complete the intravenous additive label with name and dose of medication, date, time, and nurse's initials. Attach it on the bag or bottle. Then clamp the IV tubing. Spike the bag or bottle with IV tubing and hang the IV. Then regulate infusion rate as ordered. Next one is adding medication to an existing infusion. Determine that the intravenous solution in the container is sufficient for adding the medication. Kailangan po sapat yung intravenous solution para dun sa lagayan na naka-connect sa client before administration of medication. Confirm the desired dilution of the medication, that is the amount of medication per milliliter of solution. If bawas na po, kailangan i-calculate kung ilan yung tira doon sa intravenous fluid container, IV bag niya, para ma-calculate kung ilang medication yung ilalagay based on dilution, based sa kailangang dilution ng medication na ilalagay doon. I-adjust po siya kasi bawas na yung container. So, for example, for 500 ml IV bag, if ever, kapag ang natira na lang dun, example is 300 ml, kailangan i-calculate yung medication na kailangan i-administer based on the proper dilution of the medication. Then, close the infusion clamp. Wipe the medication port with the alcohol or disinfectant swab for the sterility of the procedure. Remove the needle cover from the medication syringe, and while supporting and stabilizing the bag with your thumb and forefinger, carefully insert the syringe needle through the port and inject the medication. Remove the bag from the pole and gently rotate the bag. Rehang the container and regulate the flow rate. Then complete the medication label and apply to the intravenous container. Dispose of the equipment and supplies according to agency practice to break a chain of infection and avoid injuring others. Document the medications on the appropriate form in the client's record. Then, for the evaluation phase, conduct appropriate follow-up and include the desired effect of medication, any adverse reactions or side effects, change in vital signs. Then, reassess the status of the intravenous site and patency of intravenous infusion. Relate to previous findings if available. Report significant deviations from normal to the primary care provider. Then, the second one is administering intravenous medications using IV push. Administering intravenous medications using IV push is intended to achieve immediate and maximum effects of a medication. This type of administering medication is wherein the medication is not diluted and administered directly to the blood circulation of the client. The assessment phase. Prior to administering intravenous medications using IV push, inspect and palpate the IV insertion site for signs of infection, infiltration, or a dislocated catheter. Kapag nakita yung signs nitong mga naka-indicate dito such as infection, infiltration, or a dislocated catheter, kailangan po i-replace or ilagay ulit yung IV lock or the intravenous site or something sa client, kasi po kapag ganyan, meaning hindi nalagay ng maayos or na misplace yung IV sa client. Then, inspect the surrounding skin for redness, pallor, or swelling. Palpate the surrounding tissues for coldness and presence of edema, which could indicate leakage of intravenous fluid into the tissues. Yun nga po kapag na-misplace yung IV sa client, hindi sa blood circulation, hindi sa blood vessel, is mapupunta sa tissues which cause the edema. Kaya po kailangan i-relocate siya, yung IV, or i-replace sa client para malagay sa blood system to administer the medication. Then, take vital signs for baseline data if the medication being administered is particularly potent. While administration po nito na IV push is kailangan po i-take yung vital signs for baseline data because i-take yung vital signs before, during, and after the administration of the medication because yung ibang medication is cause ng adverse or side effects sa vital signs ng client. For example, yung ibang medication spike ng blood pressure ng client, yung iba naman ginagawang or decrease the client's blood pressure. Kaya po kailangan yun i-assess para po alam natin kung ano na yung status ng client based on the effect of the medication na in-administer sa kanya. Prior to administering intravenous medications using IV push also includes determine if the client has allergies to the medications. Check the compatibility of the medications and IV fluid. Yun nga po sinabi ko na po kanina na kailangan i-check yung compatibility ng medications and IV fluid because yung ibang medications is kapag hinalo sa IV fluid is nagkakause ng precipitation, and lalo na po dito sa direct IV push na directly ina-administer yung medication sa blood vessel ng client. Kapag po, for example, sa existing line, kapag po tig-clamp yung infusion ay yung IV tubing, tapos ni-administer na yung medication, which is, for example, that medication is not compatible with the IV fluid na nakalagay sa existing line ng client. Kapag in-administer mo yung medication doon, tapos na po, di ba, yung administration ng medication, tapos i-unclamp na po yung IV tubing, tapos po kapag nagkaroon ng interaction yung IV fluid and the IV fluid from the existing line and medication na in-administer sa client is pagkakaroon po ng precipitation or something like that, which will cause harm to the client, lalo na po diretso siya agad sa vascular system ng client. Then determine specific drug action, side effects, normal dosage, recommended administration time, and peak action time. And check patency of intravenous site. The equipments for IV push for an existing line is the client's MAR or medication administration record, medication in a vial or ampule, the sterile syringe. Example is 3 to 5 ml to prepare the medication. The sterile needles, number 21 to number 25 gauge, 2.5 centimeter or 1 inch. Needle not needed if using a needleless system because po sa needleless system is kailangan lang po i-insert directly yung syringe, no need for a needle. Antiseptic swab, watch for a digital readout or second hand, and clean gloves. While the equipment used for IV push for an IV lock are the client's MAR or medication administration record, the medication in a vial or ampule, sterile syringe 3 to 5 ml to prepare the medication, sterile syringe 3 ml for the saline or heparin flush, vial of normal saline to flush the IV catheter or vial of heparin flush solution or both depending on agency practice, and antiseptic swabs, watch with a digital readout or second hand, and clean gloves. The implementation phase has 3 parts: the preparations, performance, and evaluation. In the first phase, which is the preparations, first one is to check the MAR. Check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. Kailangan po siyang always gawin para po ma-check talaga na yung medication na i-administer sa client is yung correct medication based on provider's order. Read the label on the medication when it is taken from the medication cart, before withdrawing the medication, and after withdrawing the medication to make sure na yung na medication na yun is correct. Calculate medication dosage accurately. Then confirm that the route is correct. Then organize the equipment. The second phase is the performance. First is to perform hand hygiene and observe other appropriate infection prevention procedures. Then prepare the medication. In an existing line, prepare the medication according to the manufacturer's direction, the correct dose and dilution. Because po sa dito sa existing line, for example, the medication is ordered to be administered for 5 minutes. Pakonti-konti po yung pag-administer ng medication. For example, mag-administer mo ngayon ng 0.5 ml of medication, then i-unclamp ulit yung IV tubing kasi existing line siya. Tapos, ipa-flush yung medication ulit sa client para pakonti-konti lang yung bigay ng medication. Then, after 3-second gap na ya, or 1 minute gap, administer again 0.5 ml. Ganun po. Yun po yung correct dose and dilution. In the second one is to prepare the medication with the IV lock. First is flushing with saline. Prepare 2 syringes, each with 1 ml of sterile normal saline. Flushing with heparin, if indicated by agency policy, and saline. Prepare 1 syringe with 1 ml of heparin flush solution, if indicated by agency policy. Then prepare 2 syringes with 1 ml of each sterile normal saline. Then drop the medication into a syringe. Next one is to put a small gauge needle on the syringe if using a needle system. Perform hand hygiene and apply clean gloves. Provide for client privacy. Then prepare the client. Prior to performing the procedure, introduce self and verify the client's identity using agency protocol para po ma-ensure na mag-administer ng medication sa right client. Always verify the client's identity before doing such procedure kasi po para ma-administer yung medication sa right client. If not previously assessed, take the appropriate assessment measures necessary for the medication. Then, explain the purpose of the medication and how it will help using language that the client can understand. Include relevant information about the effects of the medication. Ginagawa po siya in-explain yung purpose ng medication and paano siya makakatulong sa client para po ma-encourage din po siya and magkaroon ng client participation in the procedure para po maiwasan din yung pag-ayaw ng client sa pag-administer ng medication. Then, administer the medication by IV push. The first variation is IV lock with needle. First is clean the injection port with the antiseptic swab to prevent introduction of microorganisms into the vascular system of the client prior to inserting the needle. So, to maintain po yung sterility na procedure, ginagawa yung pag-clean ng injection port with the antiseptic swab before insertion of the syringe. Then, insert the needle of the syringe containing normal saline through injection port of an IV lock and aspirate for blood. Ito po is done because to ensure that the IV lock is on or in the blood vessel of the client. Kapag po may na-aspirate to blood, yun, make sure po na sure po talaga tayo na ang IV lock is nasa blood system ng client, nasa tama yung site. Then, flush the lock by injecting yung needle na or syringe na ginamit for aspiration of blood is after aspiration po ng blood is itatapon na yung syringe na yun. Iba po siya sa syringe na ginagamit for flushing of the saline to the IV lock. Iba po yun. Yun po na pag-aspirate ng blood, yung syringe na ginamit dun is after the aspiration for blood, is itatapon agad yun na syringe na ginamit. Then, flush the lock by injecting 1 ml of saline slowly. Kailangan po i-flush yung lock before administration of the procedure or administration of the medication to the client para po maintaining the patency of the IV lock and flushing out the blood, the dried blood, yung mga natuyong dugo sa IV lock, and para po medyo ma-open yung blood vessel para po makadaan yung medication properly. Then observe the area above the intravenous catheter for puffiness or swelling, because po kapag merong puffiness or swelling is meaning yan is nagkaroon ng infiltration. Kailangan po i-reinsert yung IV lock sa ibang site para po ma-administer yung tapos ilagay po yung IV lock sa may blood vessel ng client para ma-administer yung medication on the correct route, which is the parenteral. Remove the needle and syringe. Clean the lock's diaphragm with an antiseptic swab. Again, every time na may bagong ilalagay na may bagong i-insert na syringe is kailangan i-clean yung the diaphragm of the lock or injection port with an antiseptic swab para po maiwasan yung pag-introduce ng microorganisms sa vascular system ng client and to maintain the sterility of the procedure. Insert the needle of the syringe containing the prepared medication through the center of the injection port. Then, inject the medication slowly at the recommended rate of infusion. Use a watch or a digital readout to time the injection. Kailangan po i-administer slowly ang medication using IV push because it is directly administered to the client, to the vascular system of the client. Kailangan po slowly para maiwasan yung adverse effects kasi kapag rapid yung pag-administer ng medication using IV push is baka magkaroon ng adverse reactions such as shock or something like that. Kailangan po nating sunodin yung recommended rate of infusion niya based sa kind of drug and the effects on the client. Then, observe the client closely for adverse reactions. Remove the needle and syringe when all medication is administered. If po nagkaroon ng adverse reaction sa client mo pag-administer ng medication, kailangan po i-stop agad yung procedure kasi po kapag tinuloy siya kahit may adverse reaction sa client, mas lalong maka-harm sa client, mas lalong mas-spike yung adverse reaction niya. And remove the needle and syringe when all medication is administered. Activate the needle safety device, which is gamit natin is the scoop method para po maiwasan yung pag-puncture sa skin natin kapag ikakap yung syringe or the needle cup directly gamit yung kamay. Clean the injection port of the lock to maintain the sterility of the procedure. And to Mama! Clean the injection port of the lock. Attach the second saline syringe and inject 1 ml of saline for flushing of the medication into the IV lock. And kapag po mag-administer ng heparin pa, is kailangan talaga yung second saline syringe administration on after the medication administration kasi po yung heparin is usually nagkakaroon ng adverse reaction kapag sa client kapag nahalo sa medication. Usually halos lahat po or maraming kinds of medication na kapag nahalo sa heparin is nagkakaroon ng chemical reaction na nakaka-harm sa client. If heparin is to be used, insert the heparin syringe and inject the heparin slowly into the lock. Slowly po kasi yun nga po na directly siyang ina-administer sa blood vessel ng client. The next variation of IV push, administration of the medication by IV push, is through IV lock with needleless system. Sa system na po na ito is no need for the needle because directly yung syringe is ina-attach na agad sa IV lock. First one is to clean the injection port of the lock to prevent the sterility of the procedure and prevent the introduction of microorganisms to the vascular system of the client. Then insert syringe containing normal saline into the injection port for flushing of the IV lock. Flush the lock with 1 ml of sterile saline. Remove the syringe. Then insert the syringe containing the medication into the port. Inject the medication following the precautions described previously, which is yun po na slowly lang po yung pag-administer ng medication and following the recommended rate of infusion ng medication based sa klase ng medication na yun. Then withdraw the syringe. Repeat injection of 1 ml of saline for flushing of the medication into the IV lock. Then the next variation for administration of medication by IV push is through the existing line. First is to identify the injection port closest to the client. Some ports have a circle indicating the site for the needle insertion. Kailangan po dun tayo sa injection port na close sa client para po ma-ensure na ma-administer agad-agad yung medication. And kailangan po sa medication port, hindi sa IV tubing because po yung IV tubing kapag doon po nilagay yung syringe, kapag doon po in-administer yung medication, after the administration of the medication is kapag tinanggal na yung syringe niya is mayroon ng butas doon sa IV tubing, malik na yung fluid doon sa tube na yun. Yun po, kailangan po talaga sa injection port na close sa client. Then clean the port with an antiseptic swab to maintain the sterility of the procedure and to prevent introduction of microorganisms into the vascular system of the client. Stop the flow by closing the clamp or pinching the tubing above the injection port. Ginagawa po siya itong clamping of the IV flow para yung medication muna yung ma-administer sa client without the dilution po muna ng IV fluid. Connect the syringe to the IV system. First one is the needle system. Hold the port steady and insert the needle of the syringe that contains the medication through the center of the port. Ito pong center of the port is yung kailangan laging i-insert ng medication ay ng syringe in of the needle of the syringe kapag mag-administer ng medication. And the other system is the needleless system. First, remove the cap from the needle injection port. Connect the tip of the syringe directly to the port. In this system, no need for the use of needles because the syringe is directly inserted into the port. Then second is the injection. Inject the medication at the ordered rate. Use the watch or digital readout to time the medication administration. Release the clamp or tubing. After injecting the medication, withdraw the needle and activate needle safety device. Ito po is after injection the medication, withdraw the needle and activate the needle safety device for the needle system, which is yung gumagamit ng needle. For a needleless system, detach the syringe and attach a new sterile cap to the port to protect the port from other microorganisms. Then, dispose of equipment according to agency practice. Remove and discard gloves. Perform hand hygiene. To break the chain of infection, lalo na po dito sa procedure na to is may chance of magkakaroon ng interaction or possible blood interaction of the client. For example po, sa blood aspiration, tapos may tendency po na minsan sa ibang, kapag na-displace yung IV lock is mag-leak out yung blood, magkakaroon ng interaction yung nurse sa blood ng client, which is a body fluid from the client. Kapag po is if ever na meron na sakit yung client na nakakahawa, na ang mode of transmission is through blood or something, and yan po, kailangan po natin maghugas ng kamay and perform other infection procedures after the procedure to break the chain of infection. Yun din po na dispose of equipment sa proper nalagayan para po to break din the chain of infection and to avoid injuring others. Observe the client closely for adverse reactions. After the medication, kailangan po assess pa rin natin yung client sa adverse reactions na pwedeng niyang ma-experience after the administration of the medication. Then determine agency practice about recommended times for changing the IV lock. Some agencies advocate a change every 48 to 72 hours for peripheral IV devices. Then, document all relevant information such as the date, time, drug, the dose, and the route of administration, the client's response, and the assessments of infusion or heparin lock site. Then, in the evaluation phase, first is to conduct appropriate follow-up for the desired effect of medication sa client, any adverse reactions or side effects, and the change in vital signs of the client. Then reassess status of IV site and patency of IV infusion if running. Relate to previous findings if available. Report significant deviations from normal to the primary care provider. Inspect appearance of medication and check expiration date. The third topic is about administering ophthalmic instillation and irrigation. First one is the administering ophthalmic instillation. It is intended to provide an eye medication the client requires to treat an infection or for other reasons. Then the other one is administering ophthalmic irrigation, and which is intended to wash out the conjunctival sac to remove secretions or foreign bodies and to remove chemicals that may injure the eye. The assessment. Prior to applying ophthalmic medications, assess the appearance of eye and surrounding structures for lesions, exudate, erythema, or swelling. The location and nature of any discharge, lacrimation, and swelling of the eyelids or of the lacrimal gland. The client's complaints, such as the itching, burning pain, blurred vision, and photophobia, because the client complaints is nag-indicate din siya ng possible injury or infection sa client. The client behavior, such as the squinting, blinking excessively, frowning, or rubbing the eyes. And determine if assessment data influence administration of the medication. If necessary ba talagang i-administer na agad yung medication or kailangan siyang ipagpaliban muna because masyadong nasasaktan, for example, yung client or hindi pa kayang i-tolerate yung procedure or something. This assessment is added to the assessment for administration of medications. Aside from this is kailangan din po i-follow yung assessment for any administration of medications. The equipments that will be used for ophthalmic installations are client's MAR or medication administration record or computer printout, the clean gloves, sterile absorbent sponges soaked in sterile normal saline, medication, sterile eye dressing or pad as needed, and paper tape to secure pad. And for ophthalmic irrigation, add irrigating solution, which is usually normal saline or pwede namang iba, pero usually yung ginagamit is normal saline. Then the irrigating syringe or tubing, dry sterile absorbent sponges, moisture resistant towel, and basis or emesis basin for collection of the solution after it leaks out from the client's eyes. The implementation. It has 3 phases: the preparation, the performance, and evaluation. In the first phase, the preparations, check the MAR or medication administration record, check the drug name, the dose, and the strength. Confirm the prescribed frequency of the instillation and which eye is to be treated. I-check po natin kung tama yung medication, yung dose niya, yung strength and frequency ng paglagay. And i-check din po kung anong mata, which eye yung kailangan i-treat. Kasi baka po yung kailangan i-treat is yung right eye lang, pero ang ni-treat natin is yung both eyes. Kailangan po i-check natin kung anong eye talaga yung kailangan i-treat. Kasi minsan po is isa lang na eye, minsan pwedeng dalawa, or minsan yung kabilang side naman yung kailangan i-treat na eye. Then, check client allergy status. If the mark is unclear or pertinent information is missing, compare it with the most recent primary care provider's written order. Report any discrepancies to the charge nurse or primary care provider as agency policy dictates. Know the reason why the client is receiving the medication, the drug classification, contraindications, usual dose range, side effects, and nursing considerations for administering and evaluating the intended outcomes of the medication. The second phase is the performance phase. First is to compare the label on the medication tube or bottle with the medication record and check the expiration date. Before administering the medication, we must first compare if the label on the medication is same with the medical record which is prescribed by the primary care provider to ensure that we are administering the right medication. If necessary, calculate the medication dosage. Then, introduce self and explain to the client what you are going to do, why is it necessary, and how he or she can participate. The preparatory steps. The three preparatory steps, the numbers 3 to 5, is the preparatory steps. Kailangan introduce self sa client and what procedure is going to be done, why is it necessary, or how he or she can participate to induce the client participation during the procedure and para po maintindihan niya rin kung ano yung gagawin sa kanya. Perform hand hygiene and observe other appropriate infection prevention procedures and provide for client privacy. Number 6, prepare the client. Prior to performing the procedure, verify the client's identity using agency protocol. Kailangan i-verify yung client's identity to ensure that we will administer the medication to the correct client. Kasi baka po minsan, kapag di natin verify yung identity ng client, ma-administer natin siya sa maling tao, ibang tao. Kapag na-administer yung tapos nagkaroon ng iba pang effect sa kanya yung medication kasi kahit di niya naman kailangan in-administer yun sa kanya. Yun po. Kailangan po is we must administer correct medication with the correct client. Assist the client to a comfortable position, usually lying. Clean the eyelid and eyelashes. Apply clean gloves. Use sterile cotton balls moistened with sterile irrigating solution or sterile normal saline and wipe from the inner canthus to the outer canthus. Kailangan po i-clean yung eyelid and eyelashes before administration of medication para po yung dirt or yung mga dumi sa eyelid and the eyelashes is hindi masama sa medication or the irrigation ay sa medication kapag mag-a-administer ng medication, which is baka makakos pa ng further infection or harm to the client. Kailangan din po i-wipe yung sterile irrigating solution sa cotton balls from the inner canthus to the outer canthus of the eye para po ma-prevent yung pagpunta ng dirt sa lacrimal sac and duct. Kailangan po from the inner canthus to the outer canthus lagi. Then administer the eye medication. Check the ophthalmic preparation for the name, strength, and number of drops if a liquid is used. Draw the number of drops into the shaft of the dropper if a dropper is used. If ointment is used, discard the first bead. Kailangan po discard yung first bead sa ointment kasi yung first bead is always considered as contaminated. Kaya po lagi siyang dinidiscard. Instruct the client to look up to the ceiling. Give the client a dry, sterile absorbent sponge. This, kailangan po yung client i-instruct natin na mag-look up sa ceiling because this position of the eye prevents blinking. Not necessarily prevents blinking, but prevent the possibility of blinking during the administration of the medication. And ito po na giving the client a dry, sterile absorbent sponge para po protect yung other skin surfaces when the eye medication slips from the eye, when it leaks or slips from the eye. Expose the lower conjunctival sac by placing the thumb or fingers of your non-dominant hand on the client's cheekbone, just below the eye, and gently drawing down the skin on the cheek. If the tissues are edematous, handle the tissues carefully to avoid damaging them. Kailangan po is dito sa baba ng eyes, ilagay yung pressure and para ma-expose yung conjunctival sac. And bawal po sa eyeball kasi kapag nagkaroon ng pressure sa eyeball, pwedeng ma-damage or magkaroon ng damage yung eyeball. Kaya kailangan po sa bony prominences lang or na nakatabi ng eyeball, which is pwede yung cheekbones or just above the eyebrows. Administer the eye medication holding the medication in the dominant hand. Place hand on client's forehead to stabilize hand. Approach the eye from the side and instill the correct number of drops onto the outer third of the lower conjunctival sac. Hold the dropper 1 to 2 cm or 0.4 to 0.8 inches above the sac. Ito po na pag-instill ng medication from the side prevents the possibility of blinking of the client while administering the medication. And kailangan po yung dropper na mag-i-instill ng medication is dito po sa range na to na 1 to 2 cm para po medyo malapit sa eyes but not necessarily hindi pwede na mag-touch sa eyes yung dropper. Kailangan po merong konting distance lang between the dropper and the eyes para po ma-estimate properly natin yung distance kung saan part i-instill yung medications sa part ng eye. Or kapag gagamit na if using ointment for the eyes, hold the tube above the lower conjunctival sac, squeeze 2 cm or 0.8 inches of ointment from the tube into the lower conjunctival sac from the inner canthus outward towards the outer canthus of the eye. All procedures na maglalagay ng medication or something, maglilinis, kailangan laging from the inner canthus outward to prevent instilling leaking of the medication or other substances into the lacrimal sac and lacrimal ducts because such events will cause systemic absorption of the medication or other substances. Instruct the client to close the eyes but not to squeeze them shut para ma-disperse, ma-disperse yung medication sa eyes ng client by closing the eyes. Pero not squeezing it masyado. Because kapag masyadong ni-squeeze is lalabas yung medication. Hindi masyadong kahit ma-disperse man siya, pero karamihan ng medication is lalabas sa mata, magli-leak. Kaya walang masyadong effect yung pag-administer ng medication kapag mag-leak lang naman sa eyes yung medication. For liquid medication, press firmly or have the client press firmly on the nasolacrimal duct for at least 30 seconds. Ito po na pag-press sa nasolacrimal duct is to prevent the leakage of the medication to the nasolacrimal duct, which can cause systemic absorption of the medication. I-avoid natin yung systemic absorption kasi for the eyes lang naman yung medication. Unnecessary siya dun sa system and baka makakos pa ng harm sa system ng client. Kaya kailangan natin i-press yung nasolacrimal duct firmly to prevent systemic absorption. And this one is for the irrigation of the eyes. First is to place absorbent pad under the head, neck, and shoulders. Then place an emesis basin next to the eye to catch the drainage. This is kailangan natin mag-place ng mga pads, absorbent pads, dito sa mga parts na to, para if ever man mag-leak yung irrigation solution after leakage from the eye, is makakatch nila para maiwasan yung pagkabasa ng damit ng client or the bed. Then the emesis basin is placed next to the eye to catch the drainage because after irrigating the eye is magli-leak yung solution, kaya kailangan may magkakatch sa kanya. Expose the lower conjunctival sac. To irrigate in stages, first hold the lower lid down, then hold the upper lid up. Exert pressure on the bony prominences of the cheekbone and beneath the eyebrow when holding the eyelids. Kailangan po dito lang sa bony prominences mag-exert ng pressure not on the eyeball because exertion of pressure on the eyeball can cause damage to the eyeball of the client. So, kailangan dito lang sa bony prominences para mag-exert ng pressure para ma-expose yung eye ng client. Feel and hold the eye irrigator about 2.5 cm, 1 inch above the eye. Again, proper distance is required, not too far and not too near na mag-touch na sa mismong eye ng patient yung irrigation tubing para magkaroon ng proper estimation yung nurse kapag mag-a-administer na ng irrigation. Irrigate the eye, directing the solution onto the lower conjunctival sac and from the inner canthus to the outer canthus. Again, all procedures must be done from the inner canthus to the outer canthus to prevent the leakage of any substance on the lacrimal sac and the nasolacrimal duct, which can cause systemic absorption. Irrigate until the solution leaving the eye is clear or until all the solution has been used. Instruct the client to close and move the eye periodically. Then for both the ophthalmic irrigation and instillation, clean and dry the eyelids as needed. Wipe the eyelids gently from the inner to the outer canthus to collect excess medication. Again, all procedures done to the eye must be from the inner to the outer canthus to prevent systemic absorption. Remove and discard gloves. Perform hand hygiene to break the chain of infection. Apply an iPad if needed and secure it with paper eye tape. An iPad is needed on times na kailangan ng proper absorption pa ng medication sa eye, kaya nilalagyan siya ng iPad to prevent the leakage of the medication from the eye. Assess the client's response immediately after the instillation or irrigation and again after the medication should have acted. Kailangan, after the medication, instillation or irrigation, is kailangan i-assess natin yung client for kung ano yung nafe-feel niya or something. Tapos, na effects or kung meron bang effect. Tapos, syempre, after a span of time, after the medication na mag-act na siya sa client, for example, 1 hour, 1 hour or 2 hours, kailangan i-assess ulit natin again yung client because yung ibang effects is lumalabas after a period of time. Minsan hindi pa siya nafe-feel agad ng client after the instillation irrigation, pero mafe-feel niya after a period of time, kaya kailangan pa rin natin i-assess yung response niya that time. Then document all relevant assessments and interventions. Name of the drug or irrigating solution, the strength, the number of drops if a liquid medication, the time of administration and response of the client. Then, in the evaluation phase, perform follow-up based on findings of the effectiveness of the administration or outcomes that deviated from expected or normal for the client. Relate findings to previous data if available. Then report significant deviations from the normal to the primary care provider. Thank you.